Welcome to an episode of One Question with Uptop Health, where our experts dig deeper on the topic at hand.
Hi, welcome to One Question with Uptop Health. And today's article we're covering, the title of the article is How to Make Confident Healthcare Business Decisions with Journey Mapping. And, we talk a lot about journey mapping, and what I find fascinating about it is it seems like such a simplistic exercise, but really diamonds can get generated out of this exercise. And what I was curious about is, in your experience, tell us about a aha moment that happened when you were working with a client on journey mapping. And Deborah, if you could start first, that would be awesome.
Absolutely. Thank you, John. So at a recent UX strategy sprint, we were working with a leading insurance company, and they were having us evaluate their internal workflow processes and tools. And during intake and discovery, we had held user interviews with the main users of the tool and seen them walk through their current process. And we actually documented that ahead of our workshop into this large journey map. I think it was over like 70 micro steps. And then we consolidated that into a condensed version for the workshop where we met with key stakeholders. This included, the decision makers, project owners, people from tech, the main users of the tool. And during the workshop, we walked through this 21-step journey map. But before we did, we actually showed them this huge 70-step process. And that in itself was eye-opening because it really showed just how many processes and steps they were going through just to create. What we were looking at was them creating a proposal for an insurance proposal. And so that in itself was helpful. And then as we dug into it and we walked through each step and we had the experts share about each step in the process, the decision maker was able to hear that. And I think that's something that's really a big takeaway, is that sometimes the decision makers are maybe a step removed from the nitty gritty and the day-to-day processes. And I remember at one point, as we were going through it, they asked, could we get rid of steps 9 to 13? Are these really important? Are they necessary? And then we got to hear from the actual users why they were actually important and why they are important to keep. But it helped to highlight that there was a lot of back and forth. In this process, there were 3, main users involved with creating this proposal, and there's a lot of back and forth that was happening between them. And so even though it was important to keep that part of the process, that was something that we ended up focusing on, was how could we streamline that back and forth and automate more. And after the whole, the workshop and the strategy sprint, we heard feedback from that stakeholder that they just had a lot more understanding of the workflow, and it made their following discussions and initiatives a lot more fruitful.
Michael, what are your thoughts?
Yeah, I worked on that same project with Deborah, so totally agree with her on that. I was thinking about this question, and there is an aha moment that came to my mind, but and I think it would be great to share, but it wouldn't put the client in a very good light. So I won't share that particular one. However, I'm going to reframe the question to what is the most common problem that I've seen, and on 2 recent large projects that we've worked on, one also in the insurance space and another in the legal industry. There was a common friction point at the beginning of the user's journey. And in both cases, it required information to be collected upfront to either initiate a quote or a case. And it was really collecting the basic information from the potential customer or client. One method used email to capture inputs from the user, while the other used a dynamic PDF to collect the information. But in both cases, the information was needed to get transcribed by another employee within the organization. So you can already start to imagine the potential problems that could occur. And this included incomplete inputs from the actual client themselves or the customers on the original form. as well as transcription issues, and the time and resource it takes to do the transcriptions was also a thing. So you know, in one of these cases, though, the organization knew that it was a problem, so they were already working on a solution to automate that process. But it was interesting. In the other case, they realized it was a problem, but they stated that it would be practically a non-starter to change that process, because there was a lot of behavioral change that would need to happen. And this occurred in a space where their services was already a commodity. So they felt that adding any more time to the client to be able to go through this automated process by filling out a form would just be a non-starter, because they would just go elsewhere for business. And so we thought that was really interesting. Although it was a huge touch point that we identified as being a problem, we did our best that we could to work around that and try to accommodate, both the prospective client and the business. But I thought it was really interesting in terms of being able to attempt to change behaviors, right? And to bring innovation, but understanding that it is really hard. It's hard for people, average people, to just go through change because typically people don't like change unless it's hugely beneficial to them. But in this case, sending an email is really simple for folks. Just throwing things in there, hitting send, as opposed to maybe going through a very methodical form. But yeah, I just thought those observations were really unique.
Okay, thanks guys. Appreciate it.
Thank you.